This is Archana, Assistant Professor from SNS College of Physiotherapy. So today we are going to see about the osteology of femur. So this is the longest bone present in our lower limb and this bone is called as femur. Now we are going to see about the osteology. So you can see the bone will have an anterior aspect as well as a posterior aspect. So now we are going to see the anterior aspect of the femur. So this femur is, you can see this, the medial aspect of the femur, you will have a spear-like structure that is called as the head. Then you can see this area we will call it as neck. Then this longest part is called as shaft, and the lower end you can see both the condyles. Okay. So in the anterior aspect, if you see, this is the right femur. Okay. So if you see here, this is the medial aspect, and here you can see over the lateral aspect there is a tubercle that is called as greater trochanter. Okay. And you can see here there is a line. Okay. So this line is called as intertrochanteric line. This is greater trochanter and this line is called as intertrochanteric line, and this is the shaft of the femur. And over the lower end you can see that this surface, this smooth surface, this area is called as the patellar surface of the femur. So this is the area where the patellar bone will get attached over the knee joint, and this area will form the patellofemoral joint. Okay. So this is all about the anterior surface of the femur, and here you can see this two aspect is called as, the medial aspect is called as the medial condyle and the lateral aspect is called as the lateral condyle. Okay. So this is the posterior surface of the femur. Now we are going to see about the posterior surface. Posterior surface you can evidently see the greater trochanter. So this is the greater trochanter, and over the medial aspect you can see this is called as the lesser trochanter. Okay. So here you can see over the anterior aspect you can see only a line that is called as intertrochanteric line. But over the posterior aspect, between these two trochanter there is a bridge, or it is very prominent, and this prominence is called as intertrochanteric crest. This prominence is called as intertrochanteric crest, and this line is called as intertrochanteric line. Okay. So this is all about the upper aspect of your femur. Then comes the lower, the shaft of the bone. Shaft of the bone you can see anterior surface was very smooth. There doesn't contain any rough surface, it is very smooth. But the posterior surface, if you see, this is very rough. And you can see over the middle of the bone, you can see a rough or sharp border. This border or this line is called as linear aspect. Okay. So over the posterior surface, you can see a sharp border or sharp ridge that is called as linear aspect. Okay. So this linear aspect, above this line is getting divided into two lines, and this area is called as what? Pectineal surface. Okay. This area is called as pectineal surface. So this area is called as pectineal surface. Okay. And below this linear aspera, you have this line is splitting again into two lines, and this two lines is called as, over the medial aspect this line is called as medial supracondylar line, and over the lateral aspect this line is called as lateral supracondylar line. And this area, this triangular area we will call it as popliteal surface. Okay. So this is area is called as popliteal surface. Now you can see below this two ends, this is the condyles of the femur, and this condyle is very larger, and this is called as the medial condyle, and this condyle is smaller compared to this, and this is called as the lateral condyle. And between these two condyles you have this fossa, that is called as intercondylar fossa. So this is all about the anterior and posterior aspect of the femur and all about the osteology. Thank you.